Now, we've been talking about assessment. Assessment's going to take a while to get through because there are so many things to assess. Last week, I started talking about assessment, and one of the things we do in martial arts is SARA. So I talked about SARA, scan, assess, react, assess, right? And you're going to continuously do that, scan, assess, react, assess. And you just keep doing that over and over and over. That's what martial artists do. That's what self-defense, you're always scanning. You assess the situation. You react to the situation. You want to know what your environment is, what your natural weapons are, what your threats are, the risks. And then you react to that, and then you assess again. And then you're going to continuously have to do that through life. And, there's so many things we want to be always assessing. Sorry, I'm drinking my little greens here. It's not just your important numbers. It's not just your blood. It's always the environment. It's the people you hang out with, the toxic people in your life or the healthy people in your life. It's environmental toxins. So many things. In fact, I want to just point something out. So often we want to be careful not to, people we love get sick. I've got two people in my life right now. One very, very special person to me who just found out he's going to have to go through chemo and surgery and radiation. And they're very healthy people. They eat healthy. They live healthy. They don't drink. And you wonder to yourself, why does this happen to people who live a healthy life? And we have this tendency to be almost judgmental about it. Be careful about that if you're doing that to people, because I don't know anybody on the planet who's 200 years old yet, right? At some point, something gets to all of us. And we just have to pay attention. We want to live. For me, it's not about the number of years I live on the planet. It's how well I live and what I leave, the legacy I leave. How many people can I help? I feel like I was given a second chance and I want to help people. I've been sick. I don't know how much longer I have. I know I have vulnerabilities. But let's try to not judge people for, clearly living healthy must not work because that person got sick. And I see that happen a lot. So think about the people in your life. Are they helping you or are they hurting you? And there's two people in my life right now who are very special, who just, one found out his mother is really sick and the other one is sick himself. And I'm praying a lot for those people and trying to help them with some things. And so, they're already living a healthy lifestyle, but it's not all about food. We know food plays a major role, but so do environmental toxins. So environmental toxins are sort of the new thing on the forefront right now. And there's a lot of information coming out. In fact, one of our newest podcasts coming up next week, we actually got to speak with Dr. Pizzorno, who is amazing. He has a book called The Toxin Solution, and you want to maybe listen to that podcast, Brain Warriors Way podcast. It's really, really good. We have a series of them with him. So take a listen to that, and there are a couple apps that can help you. Skin Deep is one, and Think Dirty is another one. They're excellent for helping you assess the toxins in your environment. So the products that you use on your body, because they make a big difference, and food's only one piece of it. People are another part of it. So in fact, last week I was talking to you guys about assessment, and keep in mind, with the exception of maybe a couple books here and there, and yes, we've got clinics for people who want to come to the clinics, but most of what we do here is to give you information to arm you. And somebody came on, I rarely get haters on my page. I got a hater on my page who was really toxic. And it happens very, very seldom for me, and I'm really grateful for that. But here's the lesson I want you to take away, okay? When people do that in your life, you have to set a precedence. Who will you teach people how to treat you. And that's really important. So for me, I spent years worrying about that stuff. I really don't worry about it anymore, but I do care when it comes to my community, because I have a very clear purpose, a very clear idea of what I want in my community when I'm teaching people on how to live their life. And, your tribe matters, number one, because it's contagious, and tribes have a light side and a dark side. So I welcome all sorts of conversation, controversy, questions. I leave all sorts of questions up that don't agree with me. But when it's toxic, it's different. When it's just mean for the purpose of being mean or toxic or degrading, that's very different. And I will welcome you to go to someone else's page, and then I will block it. So I want you to just think about that. Are there people in your life who, disagreeing with you is very different from being toxic? And I just want you to think about who in your life is causing problems and stress for you. So as we launch into assessment, just a little tip there. So scan, assess, react, assess. Today, we're going to talk about labs and lab numbers. So it might get a little tedious for some of you, but so many of you ask me about specifically what numbers should be, what the ranges are, and what they mean. So if it gets a little thick, you know, this just, you've got it. The information's here. You can come back to it. You can share it. And maybe this is or is not what you want, but we can't go on with assessment without knowing this information. And it's also in the books, The Brain Warrior's Way. This book, the information is all in there. But I'm going to go through these numbers because I'm getting bombarded with questions from you guys. So let's go through what important numbers you should know. This is most of them, maybe not all of them, but we're going to go through it. So last week when I said that your doctor is not your daddy or your mommy, but they should be your partner in health, someone didn't like that I said that. Some doctor didn't like it, but I believe it because I have actually been really sick and had doctors who were somewhat paternalistic and were adamant that I just do what they said. And that's not how I got well. Doing that didn't work for me. So I went on a journey to become my own best health advocate. That's why I share this information with you, is because to help teach you to become your own best health advocate. So as I go through these numbers, understand every lab is different. Values can be different depending on the lab you're getting your numbers, you know, worked up with, and your doctor may have an idea of what your numbers should be. Now, normal and optimal are very different, okay? Normal or average is different from optimal. A C in a class is average. Did you ever want to get all C's, right? So that doesn't mean that that's the best you could do or the best you could feel. And when I learned that, that was a huge shift in my health. So for me, when I got a new endocrinologist, I had an endocrinologist who was extremely well known to treating, you know, celebrities and all these people, and I thought I was dying. I quite honestly, he was very traditional in some of the ways that he treated, and I had thyroid cancer that had metastasized multiple times, and I had a number of other issues that came on as a result of that. I was on 9 medications. The way they were suppressing the cancer was to keep that my T4, which is, you know, one form of thyroid, really, really high, and that suppresses the cancer. That's traditional. That is the gold standard. Doesn't mean it's necessarily the only way to do it or the best, but by doing that, I felt wired, tired all the time, ended up on heart medication, sleeping medication, medication to wake up. I mean, I could go on and on. And it was like this sweater unraveling. I ended up with all these side effects and other medications I had to take, and it was miserable. It also puts you at risk for osteoporosis, causes more wrinkles because, you know, your skin starts to break down over time. It was horrible. And I just didn't, you know, I ended up with some depression, anxiety, and on and on. So that's just thyroid, and thyroid is supposed to be one of the cancers that's the safer ones to have. So I just want to point that out. When I got a new endocrinologist, interestingly, a lot of doctors would say, well, the way he's treating you is actually, like, one of them even said it was criminal because he put me on another form of thyroid to go along with the T4. He lowered the T4, balanced out my thyroid, you know, some of the other forms of thyroid. I don't want to talk about it on Facebook because I don't want you thinking that I'm not a doctor. I'm not going to treat you on Facebook, but I'll give those kinds of suggestions. The point was, he treated me in a very different way, dropped my thyroid, and immediately within 2 weeks, I felt like someone took a straitjacket off of me. So I just want to make that clear to you. You need to find a doctor who works with you, okay? Because it changed my life. So, just completely changed my life. And I want a doctor who's my partner in everything. So let's go through this. We talked last week. Body mass index is a very basic way to measure whether your weight is good or not. You can go to BMI.com or bodymassindex.com. Problem is it doesn't work well for outliers. People who are super, super fit, super muscular, or super tall, it doesn't work all that well. So it gets a little bit skewed. So one thing I like better is your waist to height ratio. That's a better measurement for just general, if you want to go get your body fat measured through different scanning processes, the scans that measure bone density, they're great for measuring your body fat, but that's a little fancier and it costs money. So waist to height ratio is a really simple way to do it. Take your height in inches or centimeters, and you can take your waist measurement, and your waist should be half of your height at least. So it shouldn't be bigger than half. And then your blood pressure. Let's move on to blood pressure. Blood pressure traditionally has always been the top number, okay, 120, so the systolic number, 120 over the bottom number, 80. Now they're saying probably more like 110 over 70. Now, some people run a little low. That's just an average. Some people, run a little higher, but you really shouldn't run too much higher. 110 over 70 is a really good number. 120 over 80 is what is sort of the norm has been for many years. If you are too low, you can be very fatigued. And if you are too high, it's a sign of hypertension, which is, a problem. You need to go see a doctor. Your CBC, or your complete blood cell count. This is a good indication of your overall health of your blood. So the reason you want to look at this, your red blood cells and your white blood cells. If your red blood cells are low, it can make you very tired, anxious, nervous, sleepy, lots of things like that. It can be an indication of anemia. If you have too many or too big, like if you have large red blood cells, sometimes it's because you're drinking too much alcohol. There can be reasons for that. So you want to just know that. White blood cells, your white blood cells, if they're too high, if the number is too high, then that can be an indication of an infection. So you always want to know what those are. Hold on one second here. Let me just get to, did I miss something? I want to make sure I'm not missing anything here as I go through these with you. I've got a bunch of notes here I want to make sure I tell you. So here we go. This is what I wanted. So the lab numbers might be a little bit different wherever you go. Just notice wherever you go that the numbers are within range. And so if they're too high or too low, okay? So let's move on to cortisol. Cortisol is a little complicated. We think people should have it measured, but my suggestion would be to have that measured with someone who actually does hormones, okay? Because if you just go to a lab and have them just test your blood whenever you have your blood tested, it's going to vary depending on what time of day it is. And it should vary. Your cortisol should vary depending on whether it's morning or evening. It depends on what time of day. But measuring it in the blood is different than measuring it, say, in saliva. And you really want to have someone measure, if you're serious about it, get it measured. They do it cyclically. So different times of the day for like 24 hours. And they'll do it a certain way that is more accurate. So I can give you the number in blood, but it's not going to be the most accurate. So I'm not going to actually give you that number. But I'm going to tell you the reason it's important. Okay, so when cortisol is your stress hormone. And if you need to have it, it needs to go up. So in the morning, it tends to go a little higher because it's going to give you energy. You're going to get up, you're going to go throughout your day. But you don't want to keep it up chronically. That's like having a white tiger in your house, or whatever kind of tiger in your house. I don't know why I say white tiger, but somewhere, like when I was growing up, I always felt like there was a tiger around the corner waiting to jump out. That's like that, always having that stress hormone on. And, traditionally like, let's say a hunter-gatherer, you always wanted to have that ability to have that, surge of cortisol because you needed to run, you needed to get away from that tiger, but then it should shut off when the threat's gone. But we live in a society now where stress is constantly high. We constantly are bombarded by emails, problems with kids, problems at work. We're in the sandwich generation. We're taking care of, aging parents and kids. And it never shuts off. And you wear that out, and that will actually put weight on your body. That stress hormone does a lot of things. It makes you fat. It makes you sick. It puts you at risk for a lot of different diseases. And you just want to make sure that you're able to sort of shut that off. So it's really bad when cortisol's high for a long time, but when it actually goes too low and you burn it out, that's actually worse. So it means you're in a different phase, and it can be really a bad thing. So I would get that checked with someone who knows how to measure hormones. When you go get your hormones checked, it's a good idea to go to someone who knows about hormones and test you at the right times in your cycles. So the normal blood level, I'll just tell you the normal blood level for cortisol technically for morning is 5 to 23 micrograms per deciliter, and in the afternoon is like 3 to 16. This isn't going to mean anything really. You should really get it checked with someone else. So let's go now to your metabolic panel. Okay, so this just checks like your liver, your kidneys, fasting blood sugar, and cholesterol. So basically, you want to have your metabolic panel should be like 70 to 99 is normal. Okay, 100 to 125 is like pre-diabetes, and then 126 is diabetes technically. So that's like your fasting blood sugar. That's your fasting blood sugar. So the issue I have with fasting blood sugar, it's a good snapshot. Fasting blood sugar, when they say 70 to 99 is good for fasting blood sugar, you want it at the lower end. You want to get it like usually around 80-ish to 85. The problem with it is it's a snapshot. Okay, so fasting blood sugar is like a snapshot in time. We'll get to hemoglobin A1C. That's a better measure for long term. But you also want to get the numbers checked for your liver and your kidneys. You always want to just know what they're doing. What are your liver enzymes? Are they working too hard or not? What's going on? So hemoglobin A1C, I like that better. You know, a lot of doctors, functional medicine doctors, always want to have a hemoglobin A1C. That's because hemoglobin A1C is a measure of sugar over time. It's over like a 3-month period. It measures what's going on with the sugar in your body as it sticks to blood cells. And it's also an indication of aging. So it like sort of gives an idea of what's going on with the aging process in your body. So you want it to be under 5.7. Okay, so definitely you want it somewhere, 4.5 to 5. 5.7 is considered prediabetes. So like 5.2. But 5.7 to 6.4 is prediabetes. 6.4 or higher suggests diabetes. So that's why that's a better measure, because it's not that snapshot. It actually shows what you've been doing over the past 3 months. Vitamin D. So vitamin D is interesting because it's one of the easiest things to fix. Most of us are low. In our clinics, when we test people, about 85% of people are low. And we live in Southern California. Everyone's wearing sunscreen. We're inside all day. We avoid the sun like the plague. And so vitamin D tends to be really low. But vitamin D is associated with, no joke, it's like associated with obesity, depression, cognitive impairment, heart disease, reduced immunity, cancer, psychosis, and almost all forms of mortality. And it's an easy thing to fix. So the norm would say 30, like the average, like you wanted at least 30, but the range is 30 to 100. We want people around 80. My doctor, my new endocrinologist, actually says it's fine as long as I'm, not higher than 100. So he wants me between like 80 and 90. So you want to be on the higher end of that range. Don't be in the 30 range. You want to be a little bit higher than that. Normally. Talk to your doctor. Always talk to your doctor about these, because there might be some reason they don't want you that high, but you always want to ask them why. Why don't they want you that high? Thyroid hormone levels. So that's the one I was just talking about. There are different types of thyroid. So your TSH, that's the one that they measure to like find out if your thyroid's sort of functioning right. Okay, so TSH, that would be between normally 0.3 and 3. Some labs would tell you up to 5 would be normal, an acceptable range. Except, guess what? Most people feel awful if it's that high. So in our clinics, we want to see it definitely below 2. Most of our functional medicine doctors want to see it like around 1. My doctor, because of the cancer, wants to see it closer to 0. So you want to go to somebody who really knows what they're doing with this. And then there's T3 and T4. Those are different types of thyroid. Make sure that the doctor you talk to knows what they're doing with T3 and T4. Some doctors believe in giving T3 and some do not. My doctor gives me T3 and it makes me feel good. Some doctors don't believe in it. I'm not going to get into that. I'm not a doctor. So I've got people here. I'd never heard of waist to height. Yes. Okay, good. Okay, so thyroid antibodies. I want to talk about thyroid here. People, for some reason, I'm not sure why a lot of doctors push back on when we give suggestions for people to get labs through their regular physician, we get pushback on some of these labs we suggest. Thyroid antibodies are one of the things we get pushback for. I have no idea why. But a lot of doctors don't want to do the thyroid antibodies, and I've got a number of stories of people we've worked with who end up with problems. One who had thyroid cancer, she insisted, even though her doctor said no, and several who had Hashimoto's disease. It's not one of those things you have to have done regularly, but you should definitely have it done periodically, just once in a while. You have to decide whether you're comfortable not having it done. If your doctor says no, I would get it done if you've never had it done. C-reactive protein, or CRP, is an indication of inflammation. So we want this done on our patients. We want to know what the inflammatory process is doing, right? So the most common reason for it is metabolic syndrome and insulin resistance. So we always want to know what's going on with that. And it can range. So a healthy range is usually between 0 and 1. So we've actually had patients come in with, I mean, just outrageous CRP, like over 20. So pretty crazy. You want to know what's going on with that. Homocysteine levels, this has been associated. Now that's another one that a lot of doctors give pushback. They don't want to do the homocysteine levels. I'm not sure why. So let's see, associated with damage to the lining of the arteries and atherosclerosis. So narrowing of the artery walls, as well as increased risk of heart attacks. It's also a good indication of that inflammatory process. So we want to have that checked. And let's see, elevated levels, anything more than 10 is usually an indication. That's you want to make sure that you're getting that treated. So talk to somebody about that. Ferritin is one of those things. So this is really interesting. It's a measure of iron stores. So this one's interesting. It can also indicate insulin resistance. So I have a tendency to naturally be insulin resistant. My ferritin tends to be low. I tend to run on the anemic side. Ferritin is one of those things, it's like the Lazarus effect for some people. For some reason, when I take ferritin, it's like, bam, my energy just goes right up. How simple is that, right? Vitamin D and ferritin, it's like miraculous. So you want to get that checked. Ferritin, let's see, normal levels for females, 12 to 150. That's like a huge range, right? So you want to talk to your doctor, figure out what works for you. Like I said, I never want to be at the low end of that. And for males, it's 12 to 300. Free and total serum testosterone levels. Again, this is a hard one because this usually depends on, I would have a hormone specialist check this. I'm going to just tell you what the issues with testosterone are, and we check everybody. We want even females checked because when your testosterone is low, it's associated not only with low energy, low motivation, low drive, memory problems, obesity, low libido, which can be problematic for, marriages and relationships, but depression, and it puts you at increased risk for Alzheimer's disease. So a lot of people think, oh, well, it's just a male hormone. Not necessarily. So we want everybody checked for it. We also want to be careful, be very careful someone doesn't just willy-nilly give you testosterone because it can cause a lot of problems, especially in relationships. You don't want to just give someone, or be taking testosterone that someone gives you and have your testosterone go high. Lots of problems with that too. So make sure that you go to someone who knows what they're doing. So let's see. Lipid panels. Okay, this one's complicated. So cholesterol, everyone, we all think we know what cholesterol is. Cholesterol is turning out to be one of the new things, sort of like the big fat myth. Well, cholesterol is turning out to be a little bit like that, right? So we always thought we knew what the number should be. Total cholesterol should be under 200, right? So that HDL should be greater than 60, LDL should be less than 100, and triglycerides should be less than 100. That's the traditional numbers. Well, the issue is now I really suggest 2 books. Eat Fat, Get Thin with Dr. Hyman. He's got a lot of great information on cholesterol. And Johnny Bowden and Steven Sinatra, who's a cardiologist, they wrote a book called The Great Cholesterol Myth. Great book. So I really love those books. I love what they both have to say about, what they all have to say about cholesterol, because it's not as simple as the number. There are people with cholesterol at 160 who dropped out of a heart attack. There are people with cholesterol, of 250 who are super healthy. So why? Because it's turning out to not be that simple. And this whole thing on statins is starting to blow up. So I'm not going to say anything more than that and get myself in trouble. Pay attention. Start watching the studies coming out on statins. It's a big deal. Okay, so that's all I'm going to say. I'm not going to get myself in trouble, but pay attention and read those books. Highly suggest it. What I will tell you is this. I would go to someone who really understands cholesterol, a cardiologist who's really savvy about this, and get an extended profile. Okay, so you want an extended profile, which means they don't just test for HDL and LDL and triglycerides. They test for what kind of cholesterol your body is making. Are you making big fluffy particles or small dense particles? Because it matters. So the type of LDL you make and the type of HDL you make. So in other words, let me give you an example. If you going through your arteries, let's just say you had BBs going through your arteries. You think it's going to do damage if they were shooting really fast through your arteries versus something that was soft and hollow or fluffy like a ping pong ball? Which one do you think is going to do more damage? Or let's just say throwing a tennis ball at a wall versus throwing a baseball at a wall, right? One's going to do more damage over time than the other one, or a beach ball. So that's why knowing what kind of molecules your body is making and understanding how to change that process is really important. And sugar is the devil. I'm just going to say that. Okay. So sugar is the devil. Not necessarily what we thought it was all along, which is certain types of fat. So read Eat Fat, Get Thin and The Great Cholesterol Myth. Wonderful books. And that's what I'm going to say about cholesterol. Mine tends to run high. My doctor does not, just a little high, like 212, whatever. And he does not want me on statins. He thinks that they are just not good for me. And the type of cholesterol I make is fine. My HDL is really high. My triglycerides are low because of the way that I eat, and my molecules are fine. So go get it checked. Know what you're doing with this. So those are some of the main things I wanted to go over with your numbers. I know that was a lot. That was probably really tedious, but let me just see if I'm missing anything. So your hormones. The only other thing I want to touch on is hormones. So I'm not going to go over numbers because, again, it's not as simple as just getting a blood test. You can get blood tests, but you need to get blood tests if you're women on certain days of your cycle, right? It depends on what phase you are in life. And it also depends on the doctor, how well they, what type of test they do. Sometimes they're saliva, sometimes they're blood, sometimes they're urine. So really highly suggest you do that. I'm all about having my hormones tested regularly. So it can make all the difference in the world in how you feel, your memory, how you sleep. But getting the wrong doses of hormone just because you think that it's like, oh, I need to get testosterone, I need to get progesterone and estrogen, can actually make you feel really awful too. So really know what you're doing. I'm not going to go through those numbers because, like I said, blood's different than urine is different than saliva, and the time of the month makes all the difference. But highly suggest you get someone to do those for you. And you can actually go to, for your brain type, you can go to our website, amenclinics.com. You can take a brain type test to help you understand sort of what type of brain you have. Are you more persistent, or are you more forgetful? Are you more compulsive or impulsive? You can figure out how to work with what you have. It's not a good thing or a bad thing, it's a thing, right? So we just want to know what you have, so you can't change what you don't measure.